Let's kick off our journey into the vital work done by Genesee Health Plan as we uncover how their extensive vaccination initiatives act as a protective barrier for the community, ensuring the well-being of residents across all ages and setting the foundation for a thriving Genesee County.
Hello, I'm Jim Ilinowski, and I'm the President and CEO of the Genesee Health Plan. Since 2001, Genesee Health Plan has provided healthcare coverage and an array of services to the uninsured residents of Genesee County. Simply, we connect people to health care. We are very excited about a grant that we received from the Michigan Department of Labor and Economic Opportunity that gets us out more in the community, and we can connect with people where they are at. Vaccines are so important because A, they can prevent someone from getting an illness like smallpox, polio, the shingles. It also helps lessen symptoms like the flu, for instance, if you get your annual flu shot. Genesee Health Plan does cover routine vaccines as well as most insurance carriers. People should check with their insurance carrier on not only are they covered, but where they can get those. Since 2015, Genesee Health Plan has held an annual vaccine event where they make it simple for people. They can just drive in and get a flu shot. They can come here and get a shingles vaccine, a pneumonia vaccine. We try to make it as simple as possible for people. It's so important for people to get, and what's nice about that event is that it's a multi-generational event. You could have a car that has parents, it could have their children, it could have a grandparent, and that's like the best way to get this so that you can keep getting it year and after year and it becomes more of a family event. We just talked about adult vaccines. Let's talk to our experts about a childhood vaccine called HPV.
When we think about public health perspectives, we're thinking mostly about how do we care for communities? How do we make sure that everyone in a community is really well taken care of, and that we are thinking about how disease spreads and how we prevent the spread of disease in the community, right? So when we think about vaccines, vaccines are one of our primary mechanisms of being able to do that. It's particularly important in kids who oftentimes are sort of doing a little bit of what they want, playing in sandboxes with other kids, putting things in their mouth, right? My young kids do that all the time. And so we have to think about our public health interventions that can prevent kids from getting disease, even when they're doing the stuff that kids are just gonna do on a daily basis, right? So we can't follow around 3-year-olds and get them to wash their hands all the time or prevent them from putting things in their mouth. But one of the things we have found is that vaccines are really great at preventing the spread of disease, particularly in babies. And we think about things like the HPV vaccines in our adolescent and older kids. HPV is human papillomavirus. It's a virus that causes several different types of cancers. Specifically, it's most well known for causing cervical cancer. It also can cause oral and pharyngeal cancers. It can cause anal cancers. And the vaccine is so important because it prevents against that risk. So it prevents the risk of getting the virus that eventually leads to these cancers that we worry about. It's important to me as a family doc primarily because I need to be able to have done the things that I recommend to patients to do. So it's really important that I can look at a patient and say, this is something that it was important for me to get, and it's something that I recommend you get. Part of what we do as being family docs and primary care docs is to really establish trust with people. And I want to make sure that when I'm having those conversations, I can say, this is something I trusted enough to do myself. I have several students who are doing great work and are in community, and I think a lot of the reasons that our students get vaccinated is the same reason that I kind of said in the office, right? They see themselves as one of the first people that are gonna have conversations with patients in the community, and they want the same thing. They want the opportunity to say, I understand this, I have learned about it, and I've looked at all of the good resources, and I made an informed decision, and I'm not gonna advise you to do something that I wouldn't do myself. I think it's so important. The first step in any patient encounter is listening, right? I think we have to understand their reasons for not wanting to get vaccinated. I think we need to lead with some empathy around understanding that the vast majority of people have a fear about something they're trying to understand that maybe someone hasn't taken the opportunity to explain to them. And so the first really goal in the office when I'm counseling someone about getting vaccinated is to try to understand why they're worried about getting vaccinated. And then we try to go from there, and I try to kind of talk about the misinformation that might exist. But it's often not a one encounter. It's often an approach where we're establishing trust and we're trying to understand the reasons why that might be fearful. And then we stepwise approach to sort of having developed that trust and maybe getting them to a place where they feel more confident about their decision to get vaccinated. I think one of the things that's really important is HPV is described most commonly as a virus that causes cervical cancer, which is absolutely true. But we often are only encouraging young women to be thoughtful about getting vaccinated. And I want us to be thoughtful about making sure we're giving that advice to all of the people who could benefit from the vaccine. So men can be carriers of the virus, and they can be people who spread the virus that often causes these cancers that I've described. And people are interacting in behaviors that can lead to the spread of the virus. So anyone who's interacting in those ways should be considering getting vaccinated, or at least having those conversations with their primary care doctor about their risk and if they need to be vaccinated or not.
My name is Kaitlin Liroff. I'm an infectious disease provider here at Hurley Medical Center. I'm also an associate professor with Michigan State University's College of Human Medicine, and I work with both residents, medical students, and patients. As a clinician, I see a couple of different things in patients that are not vaccinated for HPV. As it is such a large contributor to cervical cancer and also head and neck cancers, the most tragic thing that I see are late-stage cancers. Also, though, the main types of the virus that cause genital warts are included in the HPV vaccine. So as an everyday thing, I do see genital warts in patients that have not gotten the HPV vaccine as well. What people may not be aware of regarding HPV is that it is not just transmitted sexually. Of course, that is the main way that it's transmitted, but individuals who work in occupations such as perhaps dentistry, where they're doing a lot of work in the head and neck region, or individuals that work in like OBGYN clinics, they can also be exposed to the virus occupationally. And so it's important to get it just to protect yourself in general, however you may be exposed. So the vaccine is known to be most effective if it is given prior to exposure with the HPV virus. And almost 85% of people are exposed to the virus in their lifetime, which is why it's recommended to be given primarily to children and teenagers before they ever have any exposure to the virus. However, it is approved between ages 26 to 45, even though it's recommended to be given before age 26. So even if you haven't gotten the vaccine and you may have been exposed, it's still recommended that you talk to your provider about considering getting the vaccine even beyond the age of 26. I think that the best type of treatment is prevention. And the HPV vaccine is really incredibly effective at preventing cancers related to the HPV vaccine. In individuals who get it, it's hypothesized that it can decrease cervical cancer by 90%. And as a young woman myself, I know that cancers, pap smears, all of these things can cause a great deal of anxiety and pain. And so I just encourage everybody to do what they can to try to decrease that risk. The HPV vaccine is covered by insurance, definitely up to age 26. Beyond age 26, it is FDA approved up to age 45. I would say up to age 26, it's definitely covered. Beyond that, you should probably ask your insurance just to make sure. But it is an essential vaccine, so all individuals up to age 26 should have coverage for it. So you can get the HPV vaccine in many different locations. Definitely, you can get it at your primary care clinician offices, CVS's, Walgreens, other places that deliver vaccination should be able to give it. And you can also contact the local health department if you have any further questions to try to figure out where would be the best place for you to get it. The real reason that the HPV vaccine is important to get is that it is so effective at preventing HPV-related cancers. And I know, sexual activity is not something parents like to think about their children engaging in, but I think part of being a good parent is setting your child up for the ability to be successful in the world, and reducing risk of cancer really can enable them to exist with less anxiety. And Therefore, I think it's imperative that we do what we can.
If someone does not have health insurance for a vaccine or their family member does not, they should just simply call us at 844-232-7740 or stop by our office on 2171 South Linden Road, and we can get them health care coverage through the Genesee Health Plan or see if they qualify for any other type of health coverage. There should not be anyone in Genesee County that does not have health care coverage, so we can help you with that.